Welcome to Global Armenians on CivilNet. My guest today, joining us from Paris via Skype, is Dr. Mego Terzian. Dr. Terzian, thank you for joining us today.
Thank you.
Dr. Terzian, looking over the amount of work that you have done is really quite astounding. You were just recently elected President of MSF France, which is Medecin Sans Frontieres, or Doctors Without Borders. Congratulations on that new posting. I'm sure that you have a tremendous amount of work on your plate now that you are President of MSF France.
Thank you. It's true that the work that we are conducting is very heavy, but I am surrounded by competent colleagues, and today we have around 3,000 colleagues, especially in the missions where we are working, and I want to tell that I'm not alone.
Right. You have a very interesting biography. You were born in Lebanon. You earned your medical degree from Yerevan State University here in Armenia. And while you were here studying, you also worked for MSF as a translator in Karabakh and also as an MSF physician in Yerevan. From there, from 1999 to 2002, you worked as a field doctor in a number of countries in Sierra Leone, Afghanistan, and the Democratic Republic of Congo. In 2003, you became emergency coordinator for MSF projects in Liberia, Cote d'Ivoire, Niger, Pakistan, and the list goes on. It's one thing being a medical doctor, which is a very, very difficult profession, when you are dealing with lives, with saving lives and improving the quality of health. It's another thing when you are a doctor in war zones, in countries that are facing conflict, that have huge refugee problems. What is it that motivates you to do this kind of work?
Every time I did a mission in a different country, and every time I had honestly different motivation. The main motivation was coming from the country where I was working. Sometimes people, let's say, for example, in Afghanistan, were motivating me, considering the hard condition they were living. I was motivating myself with all the facilities that we had as Doctors Without Borders to help these people. In some context, like Iran, for example, I used to work as a doctor there. The good level of Iranian doctors motivated me to do my job very well, since we were sharing experiences. To be honest, sometimes I was learning from them a lot of medical topics. So the competence of Iranian doctors motivated me. Anyway, every time I went to a new country, to a new mission, I find out systematically a personal, let's say, motivation, and I kept all the time my motivation going on, despite the heavy context sometimes that I used to work.
Yeah, I can imagine it must be very, very difficult having to confront that kind of pain. You were born and raised in a country that had 20 years civil war in Lebanon, in Beirut, I'm assuming, where you grew up. Did that affect you? Did that impact the decisions you made to then be a doctor and help people in similar situations?
Of course, it was very strong and important experience, not only for me, for all the Lebanese that they used to live in Lebanon between 75 and up to end of 90s. So it was a big experience. We were capable several times to go out of difficult situations in Lebanon. So, of course, I used this experience in order to face new challenges in the countries where my organization is working.
You were very recently in Syria. As we all know, the war in Syria has taken a very, very heavy toll on the people of Syria. There are internally displaced Syrians. There are Syrians who are now refugees in neighboring countries. Here in Armenia, we have almost 10,000 Syrian Armenians who have fled Aleppo and Damascus and other cities where Armenians have lived before. And we actually wanted to try and Skype with you last week while you were there, but it was not possible. You gave interviews and you've spoken at the UN about the Syrian crisis, and there was one thing that you said that really resonated with me. It's just one short sentence where you said, "It is the first time I witnessed such an intense targeting of medical structures and personnel in a conflict zone." As a humanitarian organization, as an organization of doctors who try to go into these kinds of conflict zones and help people, whether that's vaccination, prenatal care, care for children, for the injured, how is Syria different from the other areas that you've been to?
Yeah, for example, I went myself to join my colleagues during the war in Libya. I have been as well 2 years ago in Ivory Coast during the war. Today we have missions in war countries like, or conflict countries like Yemen, Pakistan, even Somalia. And all these countries that I mentioned, it's different. When we are working in these countries, we feel safe by our medical activity. People and belligerents respect us and respect our work in general. By being all the time in a hospital during the war in Ivory Coast, I remember we were feeling safe despite the degree of violence in the capital of the country, Abidjan. It was the same in Libya, it was the same in Yemen, it was the same even in Gaza. But here in Syria, honestly, we don't feel safe. In Syria, to be a doctor or to be a nurse, it's equal to be a criminal person. You are systematically accused, especially by the government troops. If you are a doctor, you are criminal because you are probably assisting opposition combatants or terrorist groups, and you are systematically targeted. So this is the difference.
Even as international, but even as international aid workers or even as MSF, they still view you as a target or as somebody who is in collusion with the rebel forces? To be honest, we are present in the country, in the northern part of the country since 17 months now. Our health structures, we have 5 health structures, have been not targeted by the government troops, neither by the rebel groups. So our health structures was respected, and the security of our structures were respected. But it was not the case with other Syrian, especially Syrian doctors and nurses who were trying to work in makeshift, sometimes health centers, and their health centers were systematically bombed. Yeah, because I was reading somewhere where they said that many Syrian doctors and medical personnel had actually fled the country, and now with the tens of thousands of people who are, being wounded, are not being able to get proper medical care. We also reported a few weeks ago, the World Health Organization had issued a fact-finding paper that there were reported cases of polio in Syria because children were not being vaccinated. Is that situation still? Is that still the same situation now?
Yeah, the situation in general it's not good at all. Even it is catastrophic, I can say, if you compare the medical needs and the response of humanitarian actors. It's not adequate at all. There is huge medical and non-medical needs in Syria, in government-controlled areas, and also in opposition-controlled areas, but there is very few actors responding to to the needs. Yeah, I confirm that WHO announced that several polio cases have been reported during last week, especially in the northern and eastern part of Syria. Our team has reported one suspected case. I'm not minimizing this medical problem, polio problem. It's very serious, but honestly, it's not the main today. It's not the main medical problem in this country. There is several deaths, children or pregnant women, let's say, and they are sometimes dying with very basic disease. Since there is no access to any healthcare, this is the problem.
Dr. Terzian, just as a final question, in your role now as President of MSF France, where are the countries that you are working in? Obviously, we talked about Syria, but does MSF France have specific regions of the world that they work in, or do you respond to needs as they arise?
In general, we respond to the needs, not necessarily related to the war. We respond for natural catastrophe. We respond to epidemics. We respond also when there is a failure in public health system. It's true that 70% of our missions are located in war zone, but sometimes we are also capable to intervene in countries where there is serious medical problem. By the way, we have presence as well in Armenia. We are collaborating with the health ministry in the tuberculosis hospital in Abovian. We are as well supporting some dispensaries where tuberculosis patients are taken in charge.
Mm-hmm. Well, Dr. Terzian, you are one of the few people I would say this to, but I would hope there would come a day when your services are not needed anymore, where there is not so many conflicts and people who need your services. But I also want to thank you because I think the work that you are doing, that your organization is doing, is honorable and a much, much needed service to the world community. So I want to thank you, first of all, for that. I would love to thank you for joining us here via Skype at CivilNet. And I hope that the next time you come to Armenia, you come as a tourist and not as MSF, as the president of MSF France. So thank you once again, and I wish you the best of luck and patience and courage.
Thank you for the invitation. Thank you.
Thank you very much. Thank you for watching CivilNet.